jobs, and food top the latest survey of what voters want addressed by candidates in the upcoming midterm elections. And so much needs to be discussed about the state of our country's healthcare system. And we have with us tonight Secretary Ted Herbosa of the Department of Health. Good evening to you, Secretary. Thank you for your time.
Good evening, Cess. Good evening, Sean and Pao. Thank you for having me.
First of all, it's World TB Day, and
Yes.
we rank 4th in the world.
Correct. And that's something that I wouldn't be proud of, but I'm actually now the chairman of the Stop TB Partnership Global because I'm in the top 5. That means if the Stop TB is done in the 5 countries, we would eliminate about 78% of global TB. So we carry quite a big burden in the country. And the key there is really just plain more detection. In fact, my activity for World TB Day was getting x-rays done to all our citizens for free. So we did all over the country. We were able to do
Only
16,000. Not today, last week. The whole week last week, we were taking x-rays in different areas of the country. We had portable, ultra-portable, the one with the mobile, and people just walk in and get x-ray. We were able to do almost 17,000 x-rays.
Can you reduce our ranking in the
That's
world?
the goal. I want to get kicked out of the top 5, maybe out of the top 10.
That's
and
one list we would want to be kicked
Correct.
out of.
And I'm particularly emphasizing TB because these were one of the first instructions to me of the president. When he appointed me in 2023, he asked me the question, why are we in the top 5 in TB? So it's a big problem. It's both a social and a health problem. But TB today is detectable, it's treatable, and people shouldn't be getting it.
What is the reason nga?
It's more of a social problem. There's still stigma to tuberculosis. Many people are afraid when they get the diagnosis. They hide the fact that they have TB when in fact it's just like it can be treated with antibiotics. So,
If I may say, Doc, no, it's a secretary. It's a lot of people only find out when they have health screenings, like mandatory. Like you're
Correct.
about to get a job, and then by then you're like, how will I go to the job if they find out I have TB? And then the treatment is so long.
correct. The treatment is 6 months.
Yeah.
So that's the other problem. We are able to diagnose them on an X-ray for a job job application, but then they don't complete the treatment. And that's why we're spreading the TB.
Ayun.
How is it
Kasi they feel
complete
better.
it?
Yeah, they feel good after about 1 month of medication. Just, I'm already feeling better. I won't take the medicines. They won't complete the course, so they end up with multiple drug-resistant TB. They end up infecting the other members of their family.
So, Secretary, how is it commonly transmitted? What's the most
Airborne. Airborne, like COVID.
Right.
It's airborne. It goes in there. You cough, you
So,
speak.
at the workplace, is it or
The
Public
elevator,
transport.
public transport,
Malls,
yes.
restaurants.
Malls and restaurants. So the key really is that because it's airborne, it's easy to spread. So the key is really to treat all those, find all those that are positive, like COVID. Remember during COVID, we look for those that are infected and then treat them.
And is treatment free for the poor?
Yes, for the poor, it's free. And PhilHealth also covers it. There's some coverage. So the treatment is like you go to a treatment center, a TB
TB
dots.
dots.
Yeah, directly observed therapy center. So you go to the dots so that they will watch you take the medication. In fact, that was one of the problems during COVID. Many were isolated from their TB
So that's
dots.
why tumaas ang incidence.
Yes, kasi marami pala dito sa may TB. Di sila pupunta doon sa barangay nila. They go to the other places where no one knows them because of
Because
the
of the
stigma,
shame.
because of the shame.
But it's actually worse because you can also pass it on to children who get primary
Correct.
complex, right? And then, but also like COVID, Sec, parang some people, they don't even feel anything. And yung pala, they have TB already. In that
That's-
case, how do you know, it's like the asymptomatic people with
Correct.
COVID,
So that's
right?
the other reason why TB spreads. Most of them will be, they feel good. They probably have some slight fever at night, maybe night sweats, cough a little, and they think it's ordinary cough. Yung pala TB na. So that's why it keeps spreading because of this asymptomatic or people who don't feel anything.
Now let's go to another disease, dengue.
Mm-hmm.
And you predict that this year will be seeing a spike in cases. Why is that so?
Because January, February, we had a 74% increase. In fact, we gave away dengue larvicides and test kits to Calamba and to other places in Laguna.
With high incidence
Yeah,
of
because
dengue.
of high incidence. But that will lower down, that will trough. That's going to be because of the summer. because of the heat, kukonti yung
Pero
vector.
pag
Pagdating ng tag-ulan, tingin
wet.
ko, if it reach 74, the curve will also reach 74% increase. So we're readying and making sure that people are ready. They clean up the areas where the mosquito can reproduce. Meron kaming promotion taob, taktak, tuyo, takip. So these are the places where water,
Stagnant water.
40s.
40s.
40s, don't say it that way. Say 40s.
I only said, okay.
40s.
Secretary, is it correct when they say that itong dengue, they thrive, those mosquitoes thrive not in dirty places, but in fact in
In
clean,
clean water,
waters?
in fact.
Yeah.
That's right. And it's an urban, the Aedes mosquito likes clean water. In fact, when we did our rounds in Quezon City, in Batasan Hills, I discovered some places, walang rain, pero yung mga contador, the connections to the tubes for the piping in the house, may goma lang. And sometimes that's leaking.
It's
And then there's a
leaking.
puddle of water. Ayun, doon na, no. Then there are the bottles of yung mga refillable water.
Na
No,
nakatambak.
nakatambak with water pa inside. Yun, pinapasok.
Kaya taob.
Kaya taob, taktak,
But this
tuyo,
is
takip.
also connected to climate change.
Yes, we have a theory also that because of global warming and then the erratic rainy season, even in January, February, this led to that 74% increase. So we're just getting people aware. The way to control dengue is to lower the vector. Pag nabawasan natin yung mosquito, mababawasan yung magkakadengue.
There's also this misconception, and I've been hearing this a lot, kasi nung bata ako, ang sinasabi, sa umaga lang nagkakagat yung Aedes aegypti.
That's
That was
umaga
stripy
at
mosquito.
hapon.
That's true, umaga at hapon. They
And
actually
then now
feed.
they're saying daw they
That's
can
not
just
true.
bite daw anytime.
I
May
don't know. Let's
katotohanan
ask
ba
the
yun? I
expert.
know, I
Well,
wanted to
number
ask.
one, it's only the female mosquito that bites.
Yeah.
Because it feeds for its larva for when it's about to lay eggs. So it feeds on blood, on human blood. So sa morning, early morning, kaya yung kids at school are protected. That's why we give away this mosquito net that are treated with insecticides to kill the adults. And then we clean the water. That's where the kitty becomes a full-blown mosquito. One mosquito will lay up to about 100 eggs. And in about 4 to 7 days, adult na yung larva. Ganun kabilis mag-multiply yung Aedes mosquito.
So you're saying let's not let our guard down kahit
Yes.
na pa-summer.
Oo.
What about yung mga, kumbaga, traditional Filipino treatments? There's usually parang gulo na parang pwede ba gamitin yung tawa-tawa or ganyan. I know it's not a Western medical advice, but kung mataas na talaga yung kaso, may harm ba na subukan tong mga traditional therapies natin? Sir?
The traditional therapy, I'd still recommend, because the problem with dengue is the hemorrhagic shock. That means you end up with a second dengue infection and your blood vessels, you have a problem with your platelets, they go down, and then you start bleeding. So if you're using tawa-tawa, baka hindi mag-work, then you'll also end up going to the hospital late. So our recommendation is to go to the hospital early. We now distribute like a test kit, just like on COVID. So we can have an NS1 test, which tells you, the mother, especially kasi children ang tinatamaan nito, that it's dengue or not. So when we do the test in the emergency department, sabihin na namin, dengue yan, we can take care. Kung mild siya, you can go home. Kung medyo yung blood niya problematic, admitin sa hospital. Pero kung hindi siya dengue, kampante na yung mother. It's not dengue, it's probably just an ordinary cough, cold, flu.
Is this covered by PhilHealth?
Yes, it's
Dengue?
covered. Dengue is covered by PhilHealth. The PhilHealth pays something like 19,000 for mild dengue that's hospitalized and about 46,000 for severe dengue that you get into the ICU, you're monitored.
Let's go to the big picture, especially since PhilHealth is, there's a big controversy, a case pending before the Supreme Court. How much really of the sin taxes collected go to PhilHealth and go to the DOH? How do you distinguish?
Well, it didn't say how much goes to PhilHealth and the DOH. It just says 80% of the sin tax collected should go to the National Health Insurance, that's PhilHealth. Millennium Development Goals, at the time that law was passed, we were looking at maternal mortality, pregnant women, nutrition, TB, HIV, and
Stunting
health
nandyan
promotion,
pa.
and nutrition, and nutrition, and then also for health prevention. Those things I mentioned, MDG and and prevention is all with the DOH.
Okay.
So,
how do you
PhilHealth is just
divide?
financing.
How do you divide that 80%?
Depending on what we need, like for example, I now have a health promotion bureau that we run to promote healthy lifestyle and wellness and disease prevention. We're now buying all the vaccines for women sa HPV vaccination na push ko kay President. That's from sin taxes and money that they give us for programs what we call population-based.
So it's still the House of Representatives that will allocate.
It's like this. The population-based healthcare is Department of Health. Individual-based care is financed by PhilHealth. So if a member gets sick and goes to the hospital, part of the financing comes from PhilHealth. But for vaccinations for girls that need the HPV vaccination, that's budget given to the Department of Health. That can come from Syntax. So not everything goes to PhilHealth. I think a bigger portion
So you
actually
think
goes
there's a misconception?
Correct. I think there's a misconception. They think they're reading the law, but they stop at the first comma. But the law actually says national health insurance, MDG goals, and health promotion. The bigger portion should go to the Department of Health.
So now that it has a zero subsidy this year, you will fork
Oh, no.
out.
Be careful. Zero subsidy from government.
Yes.
But we all have a corporate operating budget of 280 billion. And then I have another 250 billion from the Department of Health. So technically, it's about $500 million for...
And how do you apportion that 80%, Doc? Can you give us a behind-the-scenes look? Does this happen at the start of every fiscal year? When do you get the money, and how do you decide? Obviously, every year things
So
will
this
be
is
different.
the budget. So every year. So now we're preparing. It's budget season. We're preparing for the budget for 2026. So we look at our programs. Like now, I have new programs like Purok Kalusugan, the Bagong Urgent Care and Ambulatory Services Center. So we're now fixing the budget so it will fund most of what we're trying to emphasize. So that becomes what's called the NEP, the National Expenditure Program, which is the President's budget. And then by around September, this is submitted to Congress, and Congress makes it himay. They look at it, they look at the programs, and then it goes to the Senate, and then it gets to a BICAM, and then it gets passed.
So this is independent pa of what is given to you by the national budget.
Correct. No, well,
The collection from
the collection from syntax is what we call a
independent.
soft earmark. Ang term ng Department of Finance, it's a soft earmark. These are taxes that can be used to fund the general appropriations, which is the budget for population health.
Well, Secretary, if we're talking about the big picture, right, I wanted to ask about lowering out-of-pocket expenses. You said you wanted to really address inequality and affordability in
Correct.
terms of healthcare, and right now for the working class, the out-of-pocket expenses are still at 60 to 70%.
Correct.
So where,
Those who actually contribute to PhilHealth.
Yeah.
That's true.
Yeah.
Diba?
That's correct, because the national health accounts looks at the share. So universal health coverage is really about making sure that all the citizens, when they get sick, wala na silang out of pocket. My idea of a universal healthcare country is something like 80 to 100% is covered. So that when the working class gets sick, they don't have to dig deep in their pocket and then pay for help.
But
in
that's
the
what's
Philippines, it's 40%. But I think it's even lower than that. Kasi in some hospitals, it's really very expensive, especially if you go to a private hospital. So the poor are now covered with universal healthcare and PhilHealth. No balance billing in the public hospital. So if you're poor, you can get brain surgery, heart operations, libre, cancer, libre lahat. My worry now is my working class, the middle class, who's the one trying to pay for the taxes. Actually, kaltas na sa kanila yung, when they get their salary, kaltas na yung tax. But when they get sick,
they still have
they have to
shell
borrow.
out.
They have to
Yeah.
borrow money. They have to loan money to pay for the hospital bills. So that's the next phase of universal healthcare. I want to get some level increase to from 40%, maybe increase out of the support to about 80%, 70 to 80% by the time I finish.
But
How?
there's
How?
That's
I
a big
know, it's a
question,
secret.
right?
How
Secretary?
muna?
Wow, because of like the,
You know
that's
what?
what I was
I have an
gonna do
answer
that.
to you. Efficient use of money. And you're not ever going to get that if you're going to put the money in the bank. That's why.
Which is what PhilHealth
Which is
did.
why we in the board in PhilHealth said, no, Let's use that to pay the health emergency allowance.
But that's what I wanted to ask because absorptive capacity also came up in the oral arguments.
Correct.
It's been coming up. Even PhilHealth has said na merong problema talaga. I'm sure there's really also a problem even with the DOH. So how do we try to increase that absorptive capacity so we
I'm
can
going to
rule?
hire Elon Musk for doing
Right sizing.
government of
I don't
government
think,
efficiency.
I don't think so.
There's a lot of money, but we need to make it efficient. I think what they're doing in the U.S. is probably the right path. If you have money, now my budget is probably the biggest ever in the Department of Health
That-
in its history.
Yeah.
200. But I want to use it
So,
efficiently.
Okay,
Right.
how will you do that?
Making sure
That's
you plan
easier
it well.
said than done.
So that's where the budgeting comes in.
Plus yung corruption pa.
Yeah, well, number one, you weed out the corruption. Make sure the corruption
you?
is
Is
eliminated.
that possible?
Have you?
Next, we try, and then the next is planning. It's like budgeting for the house. You have a certain amount of budget. You know this is what you will be spending. You make sure you spend that money. You know, last year I returned about 760 million to the National Treasury.
Oh,
The year before that, it was 1.9 billion. So
Wait a
hindi pa
minute.
siya efficient.
Pero
Hindi
it's
siya
more
efficient.
efficient. It's getting more efficient.
well, instead of giving it to fraudulent, claims,
Yeah.
but then the fact that the money is there, unutilized, it's almost like a crime.
That's right. That's right. That's what we call when the money is in the bank. That's what we call lost opportunities.
Yeah.
This is money that I could have paid for
Yeah. Saved
citizens of the
lives.
Philippines
Exactly.
that were having trouble to look for money, who loan
Okay.
money for the health. So really, I think
You
there are
mentioned an alternative is to really just make all the public hospitals free.
Yeah, that's one. One idea is to go back to that concept of free healthcare in the public hospital. But I think if you talk about efficiency, I'll talk about digitalization.
That's what
Because-
Dr. Mercado was also talking
Exactly.
about.
So if you want to use the money efficiently, like our cell phone bill, you know exactly how much your bill is. If we can do that for healthcare, efficiently be able to use digital, then I will know every centavo where it goes. I can also fight corruption with
Or data
digitalization.
analytics as
I'll
well,
use data
right?
analytics.
Do you have
This
a
is what
timeline for
DOH
that,
is doing.
Secretary?
Because Dr. Mercado of PhilHealth said 2 to 3 years it will take to completely digitalize and
For
coordinate
PhilHealth.
everything for PhilHealth. Do you think kayang ito i-roll out?
So me, I'm a little bit more optimistic. I'm saying I want services already use digital. So for example, our hospitals, government hospitals are full, pila-pila yung patient. Why don't we put out an appointment system through the phone? So that you go only to the hospital at the time of your appointment. Because now, people go to the hospital at 4 a.m. so that they will be seen at 8 p.m. Kawawa naman sila. Tapos they're absent from work the whole day. So if they have an
Kaya yan,
appointment,
ah.
I think that's a digital appointment system. We can, then telemedicine. Baka after that, follow up, you don't have to go back. We just email you the
Teleconsulting, yeah.
results.
Actually, low-hanging fruit na to from
Low-hanging
COVID eh.
fruit
From
yan.
COVID.
Exactly,
Diba?
I
We're
saw
already
it during
doing
COVID.
Yeah.
We did it in
We
COVID.
did it. We did
Pero
it.
huminto tayo uli.
Oo.
Bumalik tayo sa
Totoo yan.
face-to-face.
Next month. Next month, pwede na.
So in Cebu, they didn't give it up. They have this command center. So one of the other things, aside from that patient appointment system, I also want to build command centers in the Department of Health Central. It's like a NASA. So you know exactly where people are getting high dengue, measles, or everything. So you want that digitalization command center. And you also want the regions to do that and the hospitals to do that. That way I can, with efficiency, with
Okay.
amount of money, I can take care of
Okay.
120 million Filipinos.
We really need more than 20 minutes.
Of
course.
about this. So, we hope to see you again, Secretary, kasi ang daming tanong.
No, but I have 3 important reminders lang.
Okay.
Okay.
To keep healthy, remember my name, Ted. Tamang pagkain, ehersisyo at disiplina para sa kalusugan. Tamang pagkain, bawal ang maalat, matatamis at matataba. Ehersisyo, 30 minutes every day. Disiplina, bawal ang smoking, vape, droga at alcohol. Matulog
Napakasimple,
ng tama. Oh.
Parang kandidato,
Sleep well.
Are you sure? Thank you so much, Health Secretary
Thank you very
Ted
much.
Herbosa, and we'll see you again here on The Big Story soon.
Thank you.